Good morning. My name is Jake Angelo Ilagan. This is for Health 317 Communication and Application of Research in Practice. I will be going over ethical issues and research surrounding communication. First, identify the principles of scientific communication. So, scientific communication is the practice of informing, educating, sharing, and raising awareness of science-related topics. Scientific communicators and audiences are ambiguously defined, and the expertise and level of science knowledge varies with each group or individual. Two types of defined scientific communications are science outreach and inreach. Outreach is typically conducted by professional scientists to non-expert audiences, and inreach is expert-to-expert communication from similar or different scientific backgrounds. An example of an inreach is a scholarly communication and publication in scientific journals. 2. Explain the ethical implications in human research as it applies to the allied healthcare professionals. Ethics are broadly the set of rules, written and unwritten, that govern our expectations of our own and other behavior. Effectively, they set out how we expect others to behave and why. While there is a broad agreement on some ethical values, for example, that murder is bad, there is also wide variation on how exactly these values should be interpreted as an allied health care professional. Research ethics are the set of ethics that govern how scientific and other research is performed at research institutions such as universities and how it is disseminated. Human research is research conducted with or about people or their data or tissues with the sole intention to do good. Human research involves significant risks, and it is possible for things to go wrong. Despite the best of intentions and care in planning and practice, sometimes things go awry. Now and then, mishaps may arise because of technical errors or an ethical insensitivity, neglect, or disregard. On rare occasions, the practice of research has even involved deliberate and appalling violation of human beings. 3. Analyze the ethical issues around communication when conducting research in the allied care field. Communication involves the interchange of information between message recipients and professionals and the mass media. Health communication should adhere to the principles of beneficence, non-maleficence, respect for personal autonomy, and justice. The exchange between health professionals and patients should involve informed consent regarding the purpose and nature of the intervention and possible alternatives. There should be respect, freedom from intimidation, and suitable language understandable to patients. Public health information effectively communicated must be clear and complete, but not necessarily exhaustive. Complex explanations must be balanced by the ability of the public to comprehend and by informative detail that does not overload the public. Complex issues of benefit and risk, screening for disease, and risk factors must be carefully handled to avoid misunderstanding and misinterpretation. Cultural conceptions must be respected even when there is no scientific basis. 4. Describe how you would communicate effectively and appropriately with patients, families, and healthcare providers within the scope of practice. Ability to effectively and compassionately communicate information is key to a successful patient and to medical professional relationship. Patient outcomes depend on successful communication. The medical professional who encourages open communication may obtain more complete information, enhance the prospect of a more accurate diagnosis, and facilitate appropriate counseling, potentially improving adherence to treatment plans that benefits long-term health. This type of communication, which may be referred to as the partnership model, increases patient involvement in their healthcare through negotiation and consensus building between the patient and medical professional. In the partnership model, medical professional uses a participatory style of conversation where physicians and patients spend an equal amount of time talking. 5. Explain how you would demonstrate effective skills in writing formal correspondence to communicate information and ideas. Good written communication depends on the audience, the topic, your response in communicating, and other factors. However, all effective written communication has some characteristics in common. Good written communication forms a connection between the reader, the writer. Effective written communication is clear and easy to understand. The cause or reason for written needs to be clear to be both writer and the reader, including any specific actions you need from your audience. Good written communication sticks to the point and doesn't confuse or include lots of extraneous information to be effective. The written communication should use the correct tone, inoffensive language, and appropriate grammar. Well, this concludes my video. Once again, this is for Health 317, Communication and Application of Research and Practice, and I am Jake Angelo Ilagan, and the end.